Today by Dr. Jose Romero, who will be the acting Secretary of Health, and he will give the report today. And then, as you know, Dr. Nate Smith will be taking on new responsibilities, so he'll be here tomorrow, which will probably be his last day for a daily update. But glad to have Dr. Romero here, and he will carry on very ably. I'm also joined by Troy Wells, the CEO of the Baptist Health Systems, and I've asked him to talk a little bit later about his experience with testing in his hospitals, as well as on the capacity issue. And so I think that will be interesting and informative as well. First, let me announce that we have over 1,000 cases that have now been assigned for contact tracing to General Dynamics, who have hired 93 and actually hired another 200 that are in training. 93 are on site. We have 31 of those that are bilingual, and so that's a step forward, and Stephanie Williams, Chief of Staff, has more details on that as needed. Secondly, I do want to announce today that I am issuing a statewide mandate for face coverings. And let me explain the reasons why I believe this is necessary. First, the number of COVID-19 cases, hospitalizations, and deaths are numbers that speak for themselves and indicate that we need to do more. Secondly, I have listened to doctors and nurses who are on the front line in this fight against COVID-19, and they ask the public to do more. Thirdly, I think it's important to hear from legislators, and I've heard from legislators that have a lot of different views, but many of them simply say, I don't like it, but whatever it takes, let's get through this and give us the best chance for normal activities in the future. And then, very significantly, as a reason for this mandate, it's our children and our grandchildren. And our children and grandchildren will be going back to school this year, and they will be required in most instances to wear face coverings. And if you think about it, if you're going to ask the children in the school setting to wear face coverings for everyone's health and safety, then the adults must help them to be ready and to set the right example for them. And so for all of those reasons, I believe this mandate is appropriate and necessary. And finally, I would say that this whole fight against COVID-19 is likely to get harder and not easier. And we have to meet the challenge together, and everyone must do their part. And this is a way to enlist the support of everyone in this fight. And let me, before I go into the cases, review some of the elements of this. If you go to the screen, and this will be the executive order that I will sign and post probably later today, but it will go into effect next Monday. And so we want to give people time to understand it, to be aware of it. And this will require every person in Arkansas to wear a face covering over the mouth and the nose. It will be in all indoor environments where they're exposed to non-household members, and distancing of 6 feet or more cannot be assured. And so if you can socially distance, if you're 6 feet indoors or outdoors, then obviously that's not when we're talking about having to wear a mask. It's when you cannot social distance. In all outdoor settings, they're required in the same category where you cannot have the physical distancing. And then if you go to the next one, it has certain exemptions for people younger than 10 years of age, if there's a medical condition, if the job duties make it impossible, if you're participating in athletic activities where 6 feet distance is not achievable, if you're consuming food or drink, obviously that's important in our restaurant environment. If you're driving alone in a vehicle or the passengers are from your household, then no mask is required. If you're a couple others that are obvious, such as voting or assisting voters, then that's something that's a constitutional right, and so we don't want to interfere with that. If you're engaged in religious worship activities, but we encourage face coverings in that environment. If you're given a speech or a broadcast to an audience, but you have to be safely distanced. And so it is a mandate with the same type of exceptions that you've seen in other states, whether it's Texas or whether it is Alabama most recently. If you go to the next page, you'll see a little bit more detail on this. It does have the force and effect of law. It is an executive order that I will sign, and subsequent to that, the Director or Secretary of Health will implement it as a public health directive as well. A violation of the directive is a misdemeanor offense that's based upon Arkansas law, and upon a conviction, it could be a fine of $100 or up to $500 for a violation. If you go to the next one, this is how law enforcement and local officials should be handling this mandate. First-time offenders should receive a verbal or written warning. Secondly, violators of this order under 18 years of age shall only receive a verbal or written warning. We're not trying to bring people into juvenile court or to create problems there. It's adults that should be responsible. And then thirdly, no law enforcement officer or local official may detain, arrest, or confine in jail any person for violation of this order. This is not about arresting anyone. It's not about, it is about education, but in this case, it's also about a penalty, and it's a consequence, and so they can be issued a citation. And this order does not prohibit, but does allow law enforcement officers to enforce trespassing laws or other applicable laws if they have to remove violators at the request of a business or other property owner. And that's important for our restaurants, our businesses that need assistance from law enforcement. And then cities and counties may issue local ordinances that are consistent with this order. Obviously, they can't not do one that's in conflict with this order. And this order will automatically expire upon the termination of the emergency. And so I want everybody to understand that this is a mandate. It does carry consequences. It is enforceable, but it's being implemented in a way that allows for normal activities whenever you can do the social and physical distancing. But this is something that is necessary under the current environment. And then let me go to our case announcements. Yesterday we had 30,297 cases. Today we have an additional 817 cases. Brings us to 31,114. COVID-19 cumulative cases in Arkansas. Hospitalizations, we have an increase of 12 that brings us to 470. Deaths, we have an additional 6 deaths that brings us to 341. In terms of testing, we had a good testing day of 6,020 tests. That brings us to a rolling productivity average of 7.6%. The top counties start with Pulaski County with 114. Washington County had 68 new cases. Benton County had 48 new cases. Sebastian County had 43. We had Polk County with 40 new cases. Yell County 26, Faulkner County 27. Arkansas County is a new one, 20. And then Craighead County with 22, Garland County with 24. I believe I covered them all there. Yell County at 26, if I did not mention that. And so again, we have a broad spectrum of cases being spread across the state in different areas, but those are the top counties. The rest are fewer than 20. If we go to the graphs, you'll see it in another fashion, and you can see where we are now in perspective to where we've been. With the 800 and some cases, that's not the highest, but it's higher than we want it to be for sure. And you can see the breakdown of those that are in the community in orange versus those that are in a congregate facility. And then you see the rolling average that speaks for itself in the orange, and then that's flattened out there on top, but it's flattened out too high. The 7-day rolling average, here the hospitalizations continues to increase. We watch that very carefully, and Troy will be speaking to that momentarily. And then you'll see on the testing side, I believe, this is the percent positivity cases in our tests. And you can see it again that we're getting back down in a better level. We want that positivity rate to continue to go down. It's in the 7% range right now. And then the next one, this is the breakdown, and this is a little bit encouraging compared to the previous days. This is the date of test result and the testing facility type. And you can see that in white is our public health lab that continues to test at a very high level consistently. The red is the commercial labs, and in the last 24 hours we've had an increase in the commercial lab production or return, and so that's one of the reasons that we had a higher report today for our testing than we've had in previous days. And so with that, let me ask Dr. Romero to come to make his comments, then I'll ask Troy Wells to come.
Thank you, Governor, and good afternoon. So let me begin by saying that I am, and we at the Health Department are extremely grateful to the Governor for this mask mandate. We are excited that this is going into place. Masks have been shown to substantially decrease the transmission of COVID and are an essential part of the armamentarium against this disease. So we hope that the data will show that this will impact over time, and again are fully supportive of the mandate and the exemptions that the Governor put forth. So with that, then let me begin with let me go a little deeper with the numbers, and let me also add to this. We've had some requests for deeper dives into the numbers. These are available on the website, so very specific information is available at that site and can be accessed by all the public should they desire it. So, as mentioned, there are 817 new cases, 81 in correctional facilities, 736 in the community. Our total cases are 31,114. Active cases at this time are 6,578, with 138 in nursing homes, 978 in correctional institutions, and in the community, 5,465. With regard to hospitalizations, there are 470, an increase of 12 from yesterday. With regard to patients on a ventilator, there's an increase of 7 from yesterday, and it's currently at 101, with 341 deaths with 6 increase. Our recovered cases to date are 24,195. With regard to testing, the Arkansas Department of Health has performed approximately 1/3 of the number of tests that were performed in the last day. We have contributed 1,795 tests to that total. To date, we have accomplished 87,517 tests this month on our goal to try to reach 200,000 tests. The Governor has given a complete list of the 10 counties that are now at 20 cases or more, and I won't go into that in any detail at this time. So I'll turn it back over to you, Governor. Thank you.
And as Troy comes, let me just say Baptist Health System has really been a great partner in making sure we have adequate hospital space, but also in our testing as well. So Troy, thank you.
Thank you, Governor. I appreciate the opportunity to be back with you today, and good afternoon, everybody. I want to start off my remarks today just by pausing and recognizing and thanking our healthcare workers across the state of Arkansas. There are 11,000 associates at Baptist Health across our state, and I'm always impressed and so proud to serve with them each and every day, taking care of our Kansans. But for all of our healthcare workers, whether it be in nursing homes or clinics or hospitals across Arkansas, I want to say thank you once again for all the work that you're doing. A couple of things I want to talk about today. First, I want to just briefly talk about ICU capacity. That is a pretty common question that we get asked a lot, so I thought I'd share some information there. But before I do that, I just want to give you a little context. Baptist Health it has 11 hospitals throughout the state of Arkansas. We staff about 1,500 acute care beds across our state in multiple communities. But today I want to talk about ICU beds. We've got about 200 ICU beds in our major facilities across Arkansas. And so I want to just share some information with you about that to give you a little context about where we've been and where we are today. So I look back about 1 month ago, which happened to be the highest ICU census that we've had throughout the pandemic at Baptist Health. So that was June the 18th. We had 181 ICU patients on June the 18th out of 200 beds. Of those ICU patients, we had 16 COVID positives. All right, we had a total of 42 inpatients that were COVID positive, but 16 of those were ICU patients. So you go a month later today, we have an ICU census of 161. That's actually down from where it was a month ago by 20 patients. But we have 32 COVID positive patients in our ICU. So that number has doubled. We've got 19 patients on ventilators, which is the most we've had so far. We still have plenty of ventilator capacity at Baptist Health, and also I understand that's the case across the state. Today, we have a total of 89 COVID-19 positive inpatients in all of our hospitals, so that's also about double, just slightly more than double from what it was 1 month ago. So just a couple of, that's a lot of numbers I threw out at you, but I want to just give you some key takeaways. The COVID-19 hospital census has doubled in a month, but we still have ICU capacity. All of the large regional hospitals across the state that have ICU beds are typically running between 80 and 95% capacity on any given day. That was before COVID ever happened. And so that's something that hospitals have to actively manage day to day. And we're really good at doing that, and we're doing that now. And you see just from our numbers, you have swings of 20 to 30 ICU patients in a given day in the larger ICUs. There are adequate beds in the state of Arkansas today. Each hospital has a surge plan that they stand ready to implement if the need arises. We are fortunate in Arkansas in that we've had a long lead time to prepare for a surge in cases. And we've got plans that we can execute as needed, and we can work together as a hospital community across the state to do that. I also just want to say thank you to the governor and to the Arkansas CARES Committee for providing some financial support for hospitals across the state. That really has helped us to prepare even better now for these additional cases that we're seeing. One brief mention about lab testing. That's also a hot topic these days. At Baptist Health, we've experienced some of the same delays in receiving results from the commercial laboratories. We're limited internally on how many tests we can do per day because we can't receive the reagents that we need to run those tests. So we have multiple machines, very few reagent that we receive each week. So we rely heavily on the commercial labs, and we have seen delays up to 5 and 6 days for some of those patients that we're trying to receive results for, and that does create some challenges, particularly around surgical patients that need to have that test prior to surgery. One last thing I'll mention before I yield, and that is Baptist Health Center for Clinical Research. We are beginning a phase 3 clinical trial for a COVID-19 vaccine. And that's great news because Arkansans will be helping to develop a vaccine for COVID-19. Guidelines for who can participate in that clinical trial: you're eligible to participate if you're over 65 years of age, or if you're between 18 and 65 and you work outside the home. So that's really important. If you've been working from home for the past 90, 100 days, you may not be a good candidate for this trial. But if you've been going to work and in the public, and you're between 18 and 65, you might qualify for this trial. So anybody that's interested in learning more or trying to find out if they're eligible to participate, there's a website. It's arkansascovidvaccine.com. arkansascovidvaccine.com. So I would encourage you, if you're interested and you think you might be eligible, to participate in that clinical trial. With that, thank you, Governor, again for having me.
Thank you, Troy. With that, we'll take any questions.
I have one for Dr. Romero. You mentioned that there's a deeper dive available on the data. Are you referring to the state dashboard, or are you referring to making city-level data available to the cities who requested it?
I'm referring to the dashboard that's available to you all.
ADH stand on releasing city-level data?
At this time, we're not releasing it. We are in continuous talks about whether this should be done or not, but we're staying with the website currently.
I guess what would be the harm in releasing city-level data?
Well, let's see if we can look into that. I'm not sure whether that's an IT issue and developing it and putting it out there, or whether it's a policy issue. Do you know the answer to that?
There's also the issue of HIPAA, so that depending on the number of cases in the city, we don't want to identify people.
Well, what
Forgive me.
come up here.
So there's issues of HIPAA. It depends on the number of individuals. There is an IT issue and a policy issue. So there's multiple factors going into this. It's being discussed. It will continue to be discussed, and when it is appropriate, if appropriate, the data will be made available.
Yes.
Governor, you said multiple times that you were resisting a mask mandate because it would be impossible to enforce. So what's changed? Do you think you were wrong when you said that?
You know, that's a good question, and it's a fair question. And first of all, I resisted for many months a mask mandate because I don't believe that government coercion should be the first thing that you turn to. I hesitant about that, and we look at other alternatives, including education. Secondly, at the beginning, if you would have looked at April, whenever I first walked in here, I think it was April 4th, in which I wore a mask and CDC advised to wear a mask, and if we would have put a mandate in there, it would have been totally unenforceable. It would have been unenforceable in May. It would not have been accepted. And if you're going to have a mandate or a law or a requirement, there has to be some level of acceptance for that. Through the course of time, we have built that acceptance through education, through practice of industry, and as I said, we're going to be moving into where it's going to be in the school system. So broad acceptance allows this to be enforceable and acceptable by the public.
Is there an exemption for legislators in this building and for those in Big Mac? There's been some legislators who have publicly said that they're not going to wear a mask because Trump doesn't want to wear one. So are they exempted? What kind of compliance are you expecting?
Well, I hope they do just like President Trump, because he wears a mask now. At least we've seen him in a mask. But seriously, in terms of the use of this building, I have a lot of workers in this building. It'll be the same requirements as in other buildings in the private sector, which is that you wear a mask inside the building unless you can socially distance. And that's why we have this table designed when we can to be 6 feet apart. When you can do that, there's not a requirement for wearing a mask, and that would apply to legislators as well. There may be some type of a constitutional exemption for legislators when they're in session, but I won't get into that because I'd have to do a little study on that.
Speaking of the legislators, Senator Ballinger had a video on Facebook today where he said that he thinks there should be a special session of the legislature to decide on the mask issue and also for other issues. I was wondering what you think about that.
I don't think a special session of the legislature is what the majority of legislators want. And so I would disagree with that. The legislature has acted and given me as governor authority under our Constitution and as executive to handle an emergency, which this is an emergency, and to utilize powers to address the pandemic that we have in Arkansas that's taking lives. So I'm sure there'll be more legislative discussion on that. But I always welcome that feedback. Yes.
I have a question about the counties that are exempted. What is the thing they have to meet to be exempted from the mask? And do we have a list now of counties where this will not apply on Monday?
It's a good question, and we're still fine-tuning the language there, but we're looking at the concept that if a county has, I believe it's fewer than if a county has no positive cases for 28 days, and they are doing adequate testing in that county, then they could be exempt from the mask requirement. And where that came from is that is the same requirement that CDC issues for loved ones visiting someone in a nursing home, that they have to be positive free for 28 days. And so I took that and said that might make some sense here for a way a county can show that they really are free of COVID for that period of time in their area.
I'm sorry.
I just wondered how.
I do not know the answer to that. I don't know.
For Dr. Romero about Johnson County. 2 days ago, Johnson County's percent positive rate was 98%, and yesterday it was 90%. What's going on in that county to cause such high percent positive rates?
Would you repeat the positive numbers?
Yeah, it was 98% positive 2 days ago.
98%?
Yeah, and
Okay.
90% positive yesterday. So that's higher than our prison testing. I'm just curious.
So I'm not familiar with those numbers, and rather than speculate, I think it's best that I look into that and then get back to you on it. But I don't remember those positivity rates that high.
Is there anything remotely?
Yeah, Governor, this is Andrew with AP. Given your resistance previously on a mask mandate, wanted to see, does you changing your mind on this, does this mean that you may need to keep your mind open on other things that you've resisted in terms of reimposing restrictions, rolling back reopenings, depending on circumstances? Is that something you're also keeping an open mind on in the future, depending on what happens?
Andrew, I've always said that, we keep our options open for anything that we have to do to address the current situation and to reduce the spread. This is the best tool right now. I articulated 5 different reasons as to why I issued this mandate today. I would add that whenever you look at my desire to drive our economy forward, to make sure that we can have school, that we can have football, we can have basketball next year, whenever you can make sure that we don't have to close our businesses or put more restrictions on, this is the best tool and best opportunity that we have. This is what we've been preaching consistently through encouragement, and this takes it a step further as we get closer to the opening of school. And so this is the best opportunity we have to get life back to normal. Now, I would emphasize that if people say, well, we're going to issue this mandate and all of a sudden everything is fine, I just caution you, this is just one tool among many that we have to look at, and it's an overall strategy that we have to implement. For example, in California, Governor Newsom issued one of the first mask mandates on June 17th. Since June 17th in California, the cases have over doubled. If you look at Louisiana and you look at Texas, they've issued mask mandates. Their cases did not go down, their cases continued to go up. And so it's a longer-term strategy, and this is part of it. So there's no guarantee that we're going to have an immediate reversal of the case numbers that we have right now, but it is the tool that we can utilize and everybody can participate in that is an inconvenience, but it is of minimal disruption, and we can have hope that this will add to the other things that we're doing to bring that caseload down. Was there another question remotely?
Governor, this is Allison with 4029. In Fayetteville, the school district just issued what they're calling their hybrid model as part of a blended option. They're offering in-person instruction for students 2 days a week, and kids will have to stay home 3 days a week for virtual instruction. There are a lot of other parents across the state who are choosing to keep their kids home for virtual instruction because of COVID-19. Now, is the state at all considering offering some type of financial assistance to parents who have to stay home, potentially unable to work, to be able to care for their children? Some may not have any other option.
You're asking whether there should be financial assistance for parents who have to stay home because they opt for a virtual learning environment versus in-class instruction. And
well, in Fayetteville, there is 3 options, and none of those options include going to school for 5 days.
right, I understand now. You're narrowing it to a Fayetteville circumstance. No, if we addressed anything, it would be statewide. But the design is, in Fayetteville, to me, got off the track at least as to what I hope for, and that is that we start our school this year with in-classroom instruction. And that's the first option. And then we have a blended environment if we have to go virtual, and some will select virtual to begin with. But these are choices that they make, and there's a lot of consideration that parents have to make that are very tough. I mean, it's not an ideal circumstance. It's the same way with anybody who works anywhere. You have the potential of being exposed. You have to decide whether it's worth it for the paycheck. But we have to be able to continue in this environment to work and to learn. And so, there is some, I would emphasize that we have additional funding, actually tens of millions of dollars, that's been put into place for child care expenses. That does not even have an income limitation that will help address some of the needs of those people that go to work, but also have child care needs. That doesn't address the virtual learning option if a parent stays home for virtual learning. That's a decision that they have to make if we can be helpful in it, but we want to be able to emphasize the in-classroom instruction as the first option this year. Yes?
The rationale on exempting poll workers from the mask requirement?
I'll have to look at that again. I understand that we need to exempt the voter that comes to the polling place because they're exercising the right to vote. In terms of exempting the poll workers, I want to look a little more closely at that. So it's not filed yet. Good question. Yes?
Governor, did you have any input from any local law enforcement prior to making the decision for the statewide mandate?
I'm pretty in tune with law enforcement, and we have worked with them. We communicate on this. I have not specifically gone through the executive order with the Chiefs Association or the Sheriff's Association, but I look forward to that feedback and working with them.
Where does the state stand on implementing the recommendations from the CDC that were outlined in the report on Benton and Washington counties?
Well, we've aggressively started that. One thing I would point to is whenever we employed our new contact tracers, that it was a requirement to have bilingual. And we have, how many is it, Stephanie, of the 24 bilingual contact tracers will be part of the new batch that comes in with General Dynamics, our contractor. And so we're aggressively implementing. That is one illustration of it. Did you have anything, Dr. Romero?
So at the Arkansas Department of Health yesterday, a subgroup has met and has begun to address those recommendations. I have not, nor has Dr. Smith, had a report from them. I suspect it will take a couple of more meetings, but we are following that closely.
Is there one final question?
Yeah, this is Nick Camper with 5 News. Some cities have passed an ordinance already about face masks, and then others gave that power to businesses and sort of made it optional. What do you say to those residents living in those cities where it's been optional this entire time?
The executive order that I will sign indicates that if any local ordinance has to be consistent with the statewide mandate, and so we'll work with them and determine whether there's any issues there. Obviously, the statewide mandate supersedes. I do want to express my appreciation to the cities that have been so responsive, a number of them, in terms of the model ordinance that we submitted to them. I think that was a helpful step in education and moving our state to where we can now have a statewide consensus and mandate on it. Mike.
Given the changes that are being made at the Republican National Convention, would you recommend that delegates go, and have you made a final decision on your going?
I won't make a final decision until close to that time. There's two parts of the convention, one in Charlotte, one in Jacksonville. The one in Charlotte is more of a business meeting. They have a much smaller venue or crowd there. If that is a safe environment that's consistent with public health guidelines, then I would sure love to have the opportunity to participate and represent Arkansas in that national convention. But it also depends upon where we are in the emergency here. So while I'm planning to do that, I won't make a final decision until close to that time. Thank you very much.
Breaking news today as Governor Asa Hutchinson issues a statewide mask mandate, a statewide mandate requiring face coverings when you cannot remain indoors in a socially distant manner. He laid out his reasons. He has resisted this for many, many months. And on day 127, he issues the mandate. He says the numbers of COVID patients, hospitalizations, and deaths, he says they speak for themselves, and we simply need to do more. He says that he's spoken with doctors and nurses on the front lines who urge, again, that we need to do more here in the state of Arkansas. He talked with state lawmakers, many of whom have said, I don't like it, but whatever it takes, let's get through this health emergency. He also notes that our children and our grandchildren will be going back to school and in many cases will be required to wear a mask. Adults, he says, have to set the right example. He says this fight is likely to get harder, not easier, and this is the way to enlist everyone to help out. Again, noting that he said he resisted for many months, and he said the reason why was that he felt that he didn't believe government coercion should have been the very first thing that you turn to. He said that education and encouragement had to be in place before he could actually take this action. It is a violation with consequences, a misdemeanor in Arkansas if you're caught without one in a circumstance where you're in a situation where there are people around and you can't remain distant. You could face a fine anywhere from $100 to $500 here in the state of Arkansas. And on this day, he issues the mandate. The numbers are grim. Another 817 positive COVID-19 patients. Hospitalizations climbing to 470. So are patients requiring a ventilator. 101 COVID patients right now require a ventilator. Pulaski County again carrying the load with the highest number of new cases at 114 today. We are covering all of this for you. We will have the latest details on what this means tonight on THV 11 News at 5, 6, 6:30, and 10. We'll send things back to regular programming now. You can always catch the latest on our website, thv11.com.